Hello guys, in this video we'll discuss about diagnostic algorithm of pleural effusion. This is taken from Harrison's book of internal medicine. In the last video we have discussed about pleural effusion. So in this video we'll discuss about this diagnostic algorithm. So for any case of pleural effusion, first we have to perform diagnostic thoracosynthesis. So in the diagnostic thoracosynthesis we have to take the pleural fluid, and after taking the pleural fluid we have to send the pleural fluid for pleural fluid analysis for pleural fluid protein and LDH levels. So after sending this for pleural fluid analysis, we will get the results. So based on the results, we have to follow the Light's criteria. Based on the Light's criteria, what is Light's criteria? The Light's criteria mainly involves uh, either the first criteria will be the pleural fluid protein by serum protein ratio if it is more than 0.5, or if the pleural fluid LDH levels and serum LDH level ratio is more than zero point 0.6, or pleural fluid LDH levels are more than two-thirds of the upper limit of normal. If any one of these criteria are met, then it will be considered as an exudate. If none of these criteria is met, then it is transudate. As we have already discussed in our last video about what are the causes for transudate type of pleural effusion and exudate type of pleural effusion. If we get any one of these criteria is met, then we will consider it as an exudate. If none of the criteria is met, then we will consider it as a transudate. If transudate is found, then just we will treat the underlying causes for the transudate type of pleural effusion. That is, either will if the cause is due to congestive cardiac failure, we will treat the congestive cardiac failure. If the cause is cirrhosis, we will treat the cirrhosis, or if it is nephrotic syndrome, we will treat accordingly. So if the pleural effusion is transudate type of pleural effusion, then we will treat accordingly. But if we have got exudate, then we have to follow the further diagnostic procedures. So what are the further diagnostic procedure? We have to also check in detail about the pleural fluid glucose levels and the pleural fluid cytology, and also we have to get in detail the differential cell count of the pleural fluid, and we also get the culture gram staining of the pleural fluid and also the ADA levels of the pleural fluid, because in order to rule out the tuberculosis. In all these things, if the glucose levels are about less than 60 milligram per deciliter of the in the pleural fluid, if the glucose levels are less than 60 milligram per deciliter, then it could be malignancies, or it could be due to bacterial infections, or it could be due to rheumatoid arthritis. In bacterial infection, as the bacteria start consuming on the glucose levels which is present in the pleural fluid, so there is a decrease in that of the pleural fluid glucose levels when it is less than 60 milligram per deciliter. Then there could be a malignancies, or there could be any bacterial infections, or there could be any rheumatoid pleuritis. If none of this is found, now if every other values were normal, and you're not probably approaching to any diagnosis in this patient, then you have to send the patient for a CT scan. In the CT scan, why are you sending the patient for a CT scan? To rule out any pulmonary emboli. If you have found any pulmonary embolism, then treat the patient for the pulmonary embolism. But even if after CT scan, that is HRCT, you could not able to identify, or the patient is not having any pulmonary embolus, then you have to see for any ADA markers, that is adenosine deaminase levels. If there is any adenosine deaminase marker positive, or if it is above than the normal values, then you might be uh, suspecting that the patient may be having any tuberculosis. So treat accordingly. Treat the tuberculosis. If the patient is not having, even if the patient is not having any adenosine deaminase levels abnormal, then you have to see the symptoms, whether symptoms of the patient is improving or not. If the patient symptoms is improving, then you have to just observe. Keep the patient under observation. No need to do any other test. But if the patient symptoms are not at all improving and it's still the patient is deteriorating, then you have to consider doing a thoracoscopy or any image guided pleural biopsy. So by doing this, you could able to diagnose any other important diseases on the pleura which you could not be able to find out even after doing all these diagnoses, even after doing all these diagnostics tests. If you're not able to arrive at the right diagnosis, then the last resort should be doing thoracoscopy or image guided pleural biopsy. So by this is the diagnostic algorithm for pleural effusion. Like the video if you have found useful and share it with your friends. Thank you.